Hi, so I'm Dr. Jessica Fritz, and I wanted to show you some basic Tui Na techniques. So the first one we're going to do is pushing. With this, you're just going to push down the back. You don't want to push directly on the spine. And there's not a lot of downward pressure. After pushing, you can do what's called kneading. And so there's several different ways to do kneading. You can use the middle 3 fingers, you can use your palm, and then if you're kneading a particular point, you can use your thumb. So we're using different techniques for this patient. This is a yin technique. There is downward pressure and then a clockwise circular motion for kneading. Another basic technique is grasping. So with grasping, you have your thumb on one side and the 4 fingers on the other. This again is a more yang technique as opposed to the kneading or the pushing. This can be done in the trapezius area or the occipital area or the limbs. So that's grasping. Another great Tui Na technique is called rolling. So with rolling, what you want to make sure to do is keep your shoulder and your arm relaxed. You should notice the patient's body moving a little bit. You can do this with different degrees of rigor depending on the patient. Another tonifying technique is called rubbing. So you can do rubbing anywhere on the body, and it should create a little bit of warmth. And go down the back, and then again, since there's not a lot of downward pressure, you can go across the spine for rubbing. This one tonifies chi. It helps warm the body, the muscles, and the meridians. So that is rubbing. One more technique that we'll go over is round rubbing. And so round rubbing is really just on the surface. So unlike kneading, we're not going to stick to the skin. We're going to move around the body with round rubbing. Unlike rubbing, it doesn't go back and forth creating a friction. It just has a nice circular movement. And those are some basic Tui Na techniques. Thank you.